Wade Baskin, Doctor of Physical Therapy, and you are looking for ways to relieve your low back pain that's caused by either arthritis or spinal stenosis. Now, before we go any further, you need to make sure that this can also be found at this link below the video. It's going to take you to my blog post, unless you're already here, and we have the full treatment listed out for this condition on how to relieve your low back pain that's caused by arthritis or spinal stenosis, okay? But today I want to give you a wonderful bonus. It is the number one treatment we use, the number one exercise we use to relieve your low back pain that's caused by either of these two disorders, okay? So I'm bringing in Daniel Fowler, who uses this frequently. He also treats spinal arthritis and spinal stenosis successfully. So we want to teach you today the number one exercise we use that you can use right now to relieve your low back pain. Now keep this in mind, this should not cause pain, and before proceeding, you need to understand that you need to get qualified medical advice and release before you do this, okay? So we're not diagnosing or treating you. This is just a tip. Okay, so Daniel, go ahead and take it away and show them how to do the number one exercise for treating spinal stenosis and arthritis.
All right, we've got our subject here with one of our employees, Michael Allen. I want you to lie back on your back right here. I usually warn my patients that should they have a knee problem, they might want to do this one of two ways. We bend our knees up, and I tell the patient to either grasp their knees on top of the knees or either underneath it. If they have a knee problem, sometimes pressure on the knee will cause increased pain there. So whichever way is more comfortable to you. You reach up and you bring these knees down here, and then you just pull as tight as you can. You feel a stretch in your lower back. And you want to hold that stretch for at least 5 seconds. And as you progress, you might hold it a longer period of time, up to say 10 seconds. Then you let your feet down to this position. Rest a few seconds, take a breath or two. And then we repeat that. Usually 5 times, but sometimes as many as 10 times, depending on the patient. Some people have a larger tummy when they have this kind of problem. It's real common to have a large abdomen, so it's harder for them to hold a long period of time. But as you get stronger and as you get used to doing it, you can do it longer and longer. Pull, get a good stretch in your back, and hold.
And what this is doing, it's actually taking the spine and taking a little pressure off where the arthritis exists and where the stenosis, which is a narrowing where the nerves come out, it takes those areas and creates space there gently. So like Daniel said also, if you have a large abdomen, which is not uncommon in Mississippi, what we do is you can take the knees and you can, camera person, if you'll come over here and let me show you this. If you'll take your knees and then slightly widen them out so you can get a little around your abdomen, that's what you'll do. So you'll widen the knees, okay, and then grab your knees and pull toward your chest again. So pull the knees toward your shoulder more than straight up and together. So if you pull your knees toward your shoulder, then you'll actually get the effect that we're looking for in your low back. Okay? So that is, thank you Daniel, and thank you Michael Lynn. That is the number one exercise for treating spinal arthritis and stenosis. That is double knee to chest. Thank you, and be sure that if you're watching this video to go to the link below so you can see all that we do to help this problem, to fully treat it and get rid of it, so you can walk more than 30 minutes, stand on your feet, and do all the things you need to do in your life, okay? So this is Wade Baskin, Doctor of Physical Therapy, and I will see you at the next time when we show you something really cool and valuable for leg pain. Okay, take care.